feet is the main priority.
Okay, so let's break it down. What's going on with the feet there?
So I have on my right foot, this entire area here, this is very tender to the touch. I can't step on it. Like as soon as I get out of bed and I plant my feet on the ground, this one, it hurts really bad right here. If I'm changing my clothes, usually, you know, like you change your clothes, you like lift one leg. I can hold my weight on the left. This is just, I can't. This is just very painful here.
Understood.
And on the left, this is swollen here in the Achilles. This is very tender to the touch as well.
We could really see it bulging out here now. See that, guys? Look at that fella compared to the right one.
Yeah.
See that? It's not bulging out as much. And on top of that, I'm already seeing your lateral arches are collapsed already. So if the lateral arches collapse, that tells me no, even your medial and transverse are trouble in which they are. Look at that. See, your medial arches also collapsed too. And see how they're flattened out? So this is no, transverse arches are gone too. Okay, so continue on. So you said this is painful over here. The Achilles is over there. You also mentioned a consultation down the Martin's neuroma.
Yeah, so in October 2019, I woke up one day and randomly, as soon as I put my feet on the ground, I started experiencing pain in between the second and the third toe, the metatarsal right here. I thought it was just some sort of plantar fasciitis or that something, my foot was tired. I didn't do anything. That was October. December, I went to Mexico. January, I went skiing. And I think I just kept putting too much weight or aggravating it. And then June of 2020, something that had never happened to me, I woke up because of the pain.
Gotcha.
I'm from Puerto Rico, so I went back to Puerto Rico. There was a podiatrist there in my hometown. We found out that it was a neuroma. We injected it with cortisone, and it worked for 6 months. And then February, I think it was 2021, the pain came back, not in the neuroma. It just kept moving to different places on the foot. It moved to like the arch here, and then eventually moved to like the heel, to the back, and now it's here.
Gotcha. Okay. And let's get to the next part. So let's talk about, I believe you talked about with the TMJ and the shoulder.
Yes. So left shoulder, probably my second, third year in New York. During rehearsals, I started experiencing some like scapula pain. I went to multiple chiropractors and they said it was because I had a rib that was misaligned or out of place. Some adjustments kind of like helped it for a couple days, but it never stayed healthy. It always went back to the pain. And then that trip that I went to Mexico, I jumped 30 feet into a cenote. And then the first and the second time it was fine. The third time I kind of left my arms a little open. And as I was getting into the water, the pressure of the fall and then the water itself just kind of pushed my like shoulders and my arms up. And it kind of like, I felt an instant pain on my left shoulder. I still had like 6-7 days in Mexico, and I had to ask my sister to help me put on my shirts because I couldn't lift my left arm.
All right, let me take a look at that shoulder. So just by hearing the history, guys, when he talked about it, I said, okay, he got his arm and then now lifted. So basically what happened was, it forces the scapula to really jam forward. So we're gonna do a test over here. Do me a favor, raise that thumb, arm straight up for me, please. Okay, put it down. Now what you do is go sideways for me, please. Okay, see, it's not. So I already can see everything else is not engaged right. Put this down. So this scapula is stuck, it's fixated, not moving too well. It looks like the bicep is not moving too well either. How's that feel? Yeah, there's your bicep tendon right there, see? So it's off track. So there are two grooves over here, right? And the bicep tendon is supposed to be right over here. And there's supposed to be a ligament holding in place. But if you have some kind of nerve dysfunction, a subluxation, meaning if the nerve from here, you got a traffic jam and not moving too well, and the ligament is not holding its place, the bicep tendon can jump the track and come off, and that's where it is right now. That's what you feel. I press on it, it doesn't feel fun, right? Okay, all right, and what's going on with the TMJ?
About a month ago, I woke up, and I mentioned to you that this had happened to me a couple of times before, where I would be either eating or, I don't know, eating or chewing, and the jaw would feel like it would come out of place and then come back in. And it never stayed like that. It would get better. About a month, 2 months ago, I woke up and my jaw on the right side was completely locked. I could barely open my mouth. That day was really hard to eat, and I thought this is gonna go back to normal, whatever, but it stays locked. So the left side is very sore, and then the right one, if I were to yawn, it pops out, or if I'm eating randomly, it pops out as well.
Gotcha, so lockjaw. All right, so let's see, going down the list, so we got the TMJ, the left shoulder with that traumatic injury. Let's see, the feet thing going on with the Achilles and the lateral arches, medial arches, all those arch collapses. So I'm gonna take a look what's going on with the sacral nerves, lumbar nerves. Oh, that's right, you mentioned in the consultation also with the knee problem too. So we'll take an eye on that one.
Yeah.
So usually knee problems, usually the fourth lumbar nerve that innervates that area, and sometimes the 12th dorsal nerve as well. So these are the key areas, you know, here, 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 and there. We're gonna start narrowing things down, and so by visualization alone, yeah, you got some swelling over here, swelling here, minor swelling here, and swelling here. This instrument over here, we're gonna keep an eye on. There it is. This instrument over here helps isolate even further what spinal levels that we need to take a closer look at. Now, bear in mind, each of these objective data, we don't rely on it just by itself, because I want to be very sure that these are the areas we really want to address and adjust. As the old saying goes, if anything broke, don't fix it. So each one of these objective indicators, we want to say, okay, this is the problem, this is the problem, this is the problem. We want to correct and address that. So usually swelling is a good indicator of an area we really want to focus on. So, how's this fella? Not too bad, right?
No.
Yeah, it's moving pretty decently here. So that's now we're going to check the sacral segments. And we got a lot of puffiness right here. So we're going to take a closer look. How's that fella right there?
Just tender. Yeah. There. Yep.
Yep, second sacral segment. Not surprised about that. Check the other ones above it. How's this fella right here?
Yep.
Number 4. How's this fella right here?
Ooh. Wow.
Number 12. Right there.
Yeah.
Yep. Number 6.
Actually tender. Yeah.
Yeah, I'm not surprised about that. Okay, put that down. So you feel that big knot right there?
Mm-hmm.
Yeah, this is very swollen right here. Ooh, yeah, that's not a happy camper either. And we can see the haunted foundation itself, it's tilted towards the left. Upon a closer look over here, the sacrum itself over here, nice and straight. But what happened to number 2? Number 2, tilted this direction. So if that went that direction, everything else above it is gonna follow along for the ride. Now, as a result of that, we can't walk this way, so that's why our body gotta recompensate. So that's why over here, it tilted that direction. The mid-back tilted this direction, that direction, this direction. So that's where all these compensations started to turn into a subluxation because it was not addressed for a long time. It sits there for a while and then slowly turn into the subluxation itself. So, am I guaranteed we're going to adjust these areas? No. But after each adjustment, I'm going to post-check and make sure that these are the areas we really do need to address or not. Okay. So right now we have these potentials here, 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 and there. If we have a traffic jam over here, the nerves cannot flow properly all straight down to your feet. So the feet themselves, they require certain nerve function, right? The ligaments need to keep the arches intact. Not enough power, the ligaments get loose, and then the arches completely collapse. So if we were to say like this is the rubber band, it's like a ligament itself, again, the purpose is to keep the bones together. If you have weak nerves, okay, ligaments get loose like this. And all it takes is for the bones, they start moving around, some kind of activity, and bam, you're gonna start having some other issues, right? So we'll touch base on that in a moment. And also because of that decreased nerve function going down into your feet as well, okay? I'm not surprised, and we'll touch base on that in a moment with the x-rays, right? We're gonna take a closer look, see what's going on with your fibulas itself that's causing irritation to that left knee. This same nerve, okay, also deals with your scapula, okay? All right, so now the nerves, we have certain muscles to this fellow here, okay? And that's what's also key about that fourth lumbar vertebrae. So all the lats muscles attaches from here all straight down to the lower lumbars and the pelvis, okay? So that's why this anchor point is very crucial to restore that nerve function to it, okay? The lats also attach a part of it to also here into the inferior part of the scapula itself, the shoulder blade. We also have the rhomboids, okay? And that's where the sixth dorsal nerve is involved with. We also have the second dorsal vertebrae over here, and the nerve function deals with also the clavicle, the collarbone itself, and also part of the traps, okay? And also we're doing the lower cervical over here. That same nerve also deals with innervation nerves to the scapula, to the sits muscles, and the whole entire shebang, and including too the bicep tendon, and also as we see over here, okay, straight over there, to that ligament what we just discussed in a bit. This red rubber band, okay, that's like the bicep tendon, okay? Now we have another ligament, as we see over here, it's supposed to keep this across like this, okay? It's supposed to be nice and taut to keep this bicep tendon in place. If this is loose like this, the bicep tendon doesn't take much, and when we rotate further enough, it could jump track, pop off the groove, and go on the inside of our chest. And that's where we just confirmed on you doing that quick examination. Yeah, see, your bicep tendon over here when it really should be here. Up the belly, a little more. Ooh. There's that fella. Come on up. Wow. Wow. Wow, what?
That's crazy.
What's crazy?
No way.
No way, what?
It's way less.
What's way less?
The tenderness, just like the pain on this. I'm telling you, I couldn't, if I wanted to, I couldn't put my weight like this. Even doing this, I feel like I can put a little bit, still sore. Wow. Still there a little bit, but way less.
How much less would you say?
I was at a good 40% right now.
You want to know why?
Yes, please.
I just explained it to you. You were paying attention, man. So the sacral nerves, okay, they travel from your sacral all the way part of sciatic nerve, okay, tibial nerve, goes straight down and branches off to the plantar nerves, okay. So on over here, we'll go a little closer to the viewers over here, okay. Now the sacral nerves go on this region over here, okay, and this is the fourth lumbar nerve over here. Fifth lumbar nerve goes over here. So again, fourth lumbar, fifth lumbar, and sacral nerves goes over here. So by restoring that second sacral segment over there, the 2S nerve, okay, and the sacral nerves over here, that's why now those ligaments, they're starting to have less traffic jam, nerve function, more nerve function to it, and that loose slackness that gets decreased, now it's more taut. That's why you feel much more stronger in the arches over there. But as we can see over here to the viewers, see, take a look. We still have the medial arches. There's still an issue over here. So this is the fourth lumbar nerves. I'm going to double check, see what's going on in that fourth lumbar vertebrae. Don't keep it a secret, man. Clue us in.
walking here today, I was limping the whole day, like the whole time, right? I've been limping for the last 4 years. I don't feel, still sore like I said, but like I wasn't, still see a little bit on balance, but I wasn't able, I couldn't do this. Wow.
Pretty nice, huh?
Pretty nice.
How's the feet themselves? How do you feel the inside arches?
They feel good. They feel good. I would say that on a consistent basis, it would feel like they were really sore, really tired.
Mm-hmm. And
They don't feel like that right now. That's awesome. That's awesome.
you took the words right out of my mouth, brother.
Yeah. Wow.
Relax shoulders. Ooh. There's that fella. Stay right there.
Ooh.
Bring his arm back. So we saw in the x-ray you had a superior lateral scap. And that's exactly what you have. And it makes sense with the mechanics, you know, how you did it when you jump into that cenote over there. So now we're just gonna pump it up and we're gonna set this shoulder blade back in place. There's a part already. There's the rest. Okay, relax right shoulder. Let it go. Let it go. Feel that fella right there? Yeah. So your bicep tendon is right there. So it jumped the track. Feel that groove over here?
Oh yeah.
This is where the bicep tendon is supposed to be, but it's here right now. So yeah, this is not fun. So right now we're gonna also we're gonna open it up and hook it in. I know. And then I'm gonna replace it back in its groove. Got most of it. Also, I'm gonna do it again. Almost. It's almost in there.
Yeah.
There it is. Coming up. Okay, now get that left shoulder try.
Yes. There's improvement.
Try it. Yeah, there we go.
Yeah.
How's it now?
Yeah, I feel like I can go a little higher without hesitating or being afraid to do it.
Mm-hmm.
The front part feels way better. I still feel like it's a little locked in the back, but I remember that I probably would just get here and I would already start, feeling the discomfort. Now I can go a little higher. If I would say like the discomfort, I start feeling it probably like here now.
Mm.
Nothing on the front, mostly all of it on the back, actually.
Got it. Okay, this fill out. Let it go. Let it go. Okay, slide down a bit. Now the viewers can see this right here. This is puffy. This is Achilles. So we touch this.
Oh yeah.
Yeah, it's still tendon there, right?
Yeah.
So now that's the part of the reason why we set the sacral nerve over here. I wish we demonstrated before because this was really even more super sensitive before. See, but this right now, this calcaneus is not moving at all. Yeah. As you use over here, your talus is locked up, calcaneus is locked up. Yeah. And so we're gonna settle these poor fellas. So this is really locked up. Okay, we got most of it. Let it go. There's that fella. Like that. Calcaneus starting to work. Okay, let's get a little more of this calcaneus. Good. Okay, now let's deal with this talus. Ooh, Nelly, that cuboid's really out. Yeah, I could barely touch it.
Oh, that's tender.
Yeah, so this one way superior. Yeah, I can feel it's really sticking out crazy. It went way up. Not by a small amount, quite a bit there. Okay, first things first, let's restore this medial arch here. Oh wow, you can really see that fella bulging out. Yeah, that cuboid right there. That's one of the worst cuboids I've ever seen. Ooh. Ooh, no. Okay, pump this up. There it is. Oh. Okay, walk around when you're ready.
Oh, yeah. Wow.
Wow, what?
I can actually press a little bit on it and not shooting pain because it was always here.
And now?
It's a little sore, but I'm pressing on it, which I could never do before. Wow. I'm just really happy. I feel like I can put some weight on it.
Give it a try. Try bouncing on 1 foot alone.
Yeah. That's way stronger. You can see I've clearly lost balance on the right foot.
Yeah, it's going to take some time for your sensors to recalibrate with your gyroscope, the cerebellum in your brain over there.
Yeah.
And get your balance back on that. So that's going to be your homework on that one. You're going to be having that one. Okay. Overall, how much improvement you notice would you say with that right foot right now?
Oh my God. The right, 60, 70%.
Nice.
Just the fact that I could put, like, even like, you know, like on one foot, on one leg. I could do this with the left. I could never put my weight on the right. I can do this right now. Like you said, sore. It's going to need time, but I can do this.
It's very slow in there, just like as the viewer saw over there as well. Okay, that thing was bulging out like crazy. So your homework with that fella is this: you're gonna get a nice bucket, fill it up with ice cold water. Okay, and also dump in 2 cups of Epsom salt.
Okay,
all right, that'll pump all that swelling out of there.
Okay.
Now let's take out your jaw.
Yes.
So this is the TMJ with the EX. What we're talking about is this. Okay, see this height over here? You see that height over there? This is much more taller and this is much more narrow, right? So yeah, that's a problem. And see this tip of the mandible over here? You should be here. You went way over to the left. Yeah. So we got one heck of an external rotation on that fellow over there. Okay, open, close, open, close, open, close. There it is. All right, come on up. All right, go ahead. Try that jaw now.
Yeah. I still feel a little like clicking, but I can open it. Yes. It would stay locked pretty much until maybe like here. Mm-hmm. Now like, wow. That's awesome. That's awesome. Yes, that's awesome. Thank you. Thank you so
you're
much.
very welcome. You're
Yeah.
very welcome. All right, so we pretty much covered, everything we covered for today was we had the lockjaw, the shoulders, so okay, the knees, the feet.
Yeah.
Anything else?
Oh, that's it for now.
All right. Okay. Well, you got your homework there.
Mm-hmm.
We're gonna do a follow-up on the next visit and see how everything comes along.
Sounds good. Thank you so much.
Oh, you're very welcome.
Thank you.
All right, sir, give us the latest updates. How's everything coming along?
Left foot, the Achilles part less swollen, feels much better.
Good.
The right foot, still a little pain. The first day after the first adjustment at work, it felt really good. The next 2 days, it started feeling a little more like back to normal.
Yeah, I can see it already. It's I see it's knocked out again. That like superior cuboid's out again. Okay. And how's the shoulder?
Left shoulder, after the first day adjustment, it felt so much better. I was able to raise my arm without any problem. I did the exercises that you told me to. After the first day, it felt good. Yesterday, I started feeling a little numbness going on, but it's way, way better than before I visited you.
Okay, try to do a little more. Excellent. There we go. Good. There we go. Good. Good.
Yeah, it's still way out. Okay, good. We got most of it. Yeah, there we go. We got most of it in there. There it is. There's the rest.
So still need a little set. There's a C. AC's fine. A little bit out. There we go. Still a little bit out. There's the rest. There it goes. Okay, stand up. All right, give that left shoulder a whirl.
Yeah,
Nice.
much better. Ooh, much better. Much better.
Okay.
Yep.
There we go.
There's that fella.
Oh, yeah. See, the cuboid's still very swollen here. Oh, yeah. Yeah. Keep it up before we set it. There we go. There's that clunker. Okay, walk around, see you like it.
Yeah, there's an improvement there.
Yeah, keep icing that up, okay? That's a very swollen misaligned bone over there, okay?
Yeah.
It's gonna take some more time to get that fella calmed down, all right?
Yeah, thank you.
Oh, you're very welcome. See you next time.
See you next time.
All right, give us the latest updates. How's everything coming along?
Happy to report on all 4 levels. There's been some improvements. I don't hear as much or feel as much popping on the jaw, which is good. I've been able to eat better. The right foot has been an amazing improvement. I've been able to put weight, balance myself better on it. So it's going really well. Left foot, still a little sore, tender to the touch, especially in the Achilles one, but also better. And then the left shoulder as well. I've been able to lift more weight, just like with a gallon of water or the gallon of milk, whatever. So it's been way better. There's been improvements.
Great, let's take a look at that. The right foot right there?
Right. Yeah.
Yeah, see, so right now, yeah, that cuboid cinder right there, you know, that's doing a lot better, getting more stable, it's not bulging out compared to before, whatever.
So, all right. That's great progress. We're going to keep at it, all right? Thanks for the updates.
Thank you.
Oh, you're welcome.